This time on Poll Hub, childhood vaccines are in the news as federal guidelines have changed. Plenty of medical experts say this is a big mistake and could cost lives, but what do most parents think? We're going to discuss and look at the numbers. Then, this is a long weekend with MLK Day on Monday, and we thought this would be a really good time to revisit the history of the holiday. And there is a lot of history behind this, but also what it means in the Trump era. And finally, Trump or Obama? Well, what's the question? Hang out for the fun fact to find out. And hi, everybody. Welcome to Poll Hub. I'm JD Dapper.
I'm Barbara Carvalho.
I'm Mary Griffith.
And I'm Lee Marengoff.
Earlier this month, the Department of Health and Human Services, under the leadership of Robert F. Kennedy Jr., announced a major shift in U.S. vaccination policy, and it pertains to childhood vaccinations. And now the policy more closely resembles what is taking place in European countries such as Denmark. The policy now requires vaccination from 11 diseases versus the previous 17. So how does this shift align or not with public opinion, and what does this mean for American families? Before we get to the numbers, I just want to sort of provide an overview of what the policy now is. In essence, there are now 3 different categories of vaccinations for children. The first are those that are recommended. These are the big vaccinations, those for polio, MMR, pertussis, HPV, and varicella. Those are the recommended. Then there's another category, which are for children who are at higher risk. And then there's the third, which is recommended after shared decision-making with a doctor. And here, that really applies to vaccines for the flu, rotavirus, COVID-19, Hep A, Hep B, meningococcal vaccinations. And I think the flu vaccine is probably one of the most important, but we can discuss that later here. Jay, where does this all stand, in terms of public opinion? Do Americans support the change to the policy?
Yeah, it's a somewhat of a mixed bag, and I think what we've learned in almost every question in the last decade, or maybe even longer, is there's a strong partisan divide. But let's skip the partisan divide for a second and just talk about all Americans. In terms of the question of the CDC reevaluating the childhood vaccine schedule, and there was talk about this reevaluation last year. This just went into effect, but there was polling around the prospect of the reevaluation. 49% of registered voters in a Children's Health Defense Zogby poll, 49% supported reevaluating the childhood vaccine schedule. 30% wanted to maintain it, 21% undecided. Parents in particular, parents with young children, showed a stronger support for review. So 60% in that poll said, hey, we should be looking at this vaccine schedule. Another poll, KFF, Kaiser Family Foundation, which is a health poll and a foundation, but the polling they do is around health. And the Washington Post did a poll last year. In that, 16% of U.S. parents, again, just the subset of parents, reported that they had delayed or skipped at least one of the recommended childhood vaccines. And finally, when you talk about parental confidence in whether these recommendations over the years are actually effective, 57% of parents in a Pew poll from last year are either extremely or very confident that childhood vaccines are highly effective at preventing serious injuries, or illness, I should say. That's 57%, so almost 6 in 10. But confidence drops when it comes to safety testing. That's down to 44%, and even more so when it's the vaccine schedule's safety. So the safety of the schedule itself, that's down to 41%. And again, I'll just mention, there's a big partisan divide. Democratic parents support or have much higher confidence in this than Republican parents.
So, Barb, where does the controversy really lie in here? Is it the change in the policy, or is it the way in which the change came about?
Well, I think this is something that just didn't happen today. We have been looking at really decades of a lack of confidence in our healthcare system and a lot of misinformation about the safety of vaccines and childhood vaccines in particular. The whole misinformation of relating childhood vaccines to autism and other problems with child development has just completely undermined confidence that parents and Americans as a whole have in our vaccination protocols and system. And I might add, COVID, which is certainly more recent, but the politicization of COVID and the vaccinations that followed, I think, continued to undermine that confidence. And understand this is about public health. And I think the biggest change here, which is very different than the decades when each of us grew up and we generationally, we were children at, different times and different decades and generations. But we have moved from a period of time where there was incredible confidence in vaccinations and the fact that they solved a great deal of misery. I'm thinking particularly, of the polio vaccine, that certainly there was some skepticism initially, but literally families lined up for that vaccine. I think of other ones such as measles is now a controversy. It pretty much, the vaccine eliminated childhood measles, which was a devastating illness and still can be in countries that do not vaccinate. So there has been, just like other institutions, and we've talked about this many times, about this undermining of the institution of public health. And public health is about community. It's not about the individual. I know that's hard for us to understand and to think about, especially, if it's my child. The culture is that there needs to be parent involvement and parent decision making. But public health is about the collective. And given the misinformation, the lack of scientific research, and the fact that these things are feeding, those decisions and that policy is pretty frightening. And I think is going to have very significant consequences for future generations.
Barbie, bringing up a really good point about community. And we talk about vaccinations like MMR. Well, I'm the RMR, the resident mom in the room. And so when I think about vaccines and when I heard this announcement came out, it wasn't a surprise, but it was still jarring because it was this idea of what does this mean? And so when I'm going through and looking at the different vaccines, of course, things came up like, well, can my children still get these recommended with consultation with a doctor? Can they still get those vaccinations? Yes, they can. Will my insurance, still pay for these vaccines? Yes, it will. But as I'm going through this, it started to occur to me that even under the old schedule, I would have candid conversations with my children's pediatrician, which is, what does this mean? Should my child be getting this? What would you recommend? So there has always been, in my personal experience, that consultation for vaccines that were not recommended. But what really occurred to me is that I chose my children's pediatrician for whatever reason. Might be their approach to medicine. It might be their ideology, whatever it is. So there is, when we think about politics, there's the echo chamber reinforcing beliefs. So when there is that option to consult with your doctor who may reflect your own opinion, there is that concern that you are focused on the individual as opposed to the community. And Lee, Barb mentioned the politicization of this. No, again, this was not a surprise. There has been talk from RFK Jr. and the Trump administration about making these changes. But in terms of messaging, what is this really saying? Not just for the medical community and for health issues, but just in terms of where things are going with the administration now that we're past 1 year of Trump in Trump 2.0.
Yeah, I think this is a great example of something which is a life or death kind of pathway to go as a society and as our nation, and a notion that, it's now in the middle of the political Cuisinart, to borrow a phrase from others, but it's being chopped up and spewed out as most other issues, be they serious or not so serious, are in the current high-intensity politics. So, yeah, I mean, I think underlying this is a notion of, what value do you place in scientific information versus rumors? And to what degree are you willing to let this go in the battle that all of you have talked about, the my choice versus, some of this stuff is very contagious and it has ramifications. So if my child does a vaccine on something and yours doesn't, you're making my child vulnerable. And so this is not a free ride. It's a ride of, as you say, of community and connectiveness. And right now there's a big chasm between the different sides on this. And there seems to be less of a middle ground. And, can we have advances in the public health where we better understand what's going on? Absolutely. But are we making ourselves vulnerable to bigger problems that might occur if we go down that road of making this optional or maybe eliminating it? And, we're in a very radical time in terms of the public health community, and things are changing dramatically in that area. And we just have to make sure that good policy follows good science, and we don't have a bad policy following no science. And I think right now there's the rumors and the misinformation, and some of that's from the scientific studies as well, where we find out, whether autism is a result of vaccines or not. And, it seems to be somewhat mixed sometimes, but we don't seem, given that the conclusions have already been drawn by a lot of people, we don't seem eager to have any dialogue to work out what might be the best policy going forward. So right now, it's become part of our, the political grinder, and that's really dangerous, given what you're talking about.
And it's certainly the comparisons to Europe. I mean, I think there's a lot that we can take from the European health system, and this probably isn't one of them. And the reason for that is because there is access to healthcare. There is broad access to preventive care. So I think these, the judgments that are made in these other countries are more likely to be based on science, which has to do with the nature of those populations, which has to do with the diversity of those populations, and the extent to which healthcare is accessible to everyone in those countries and in those communities, of which that is something that we very much have to guard against other kinds of health issues, because we don't have that kind of a supportive health system for and access for everyone.
Yeah, I'm just curious, is this because we've forgotten? I was reading letters that my mother had sent to her mother in the 50s before I was born. And there was a letter in particular about the kids have gotten the Salk vaccine. It was very exciting. We had polio in the family, a lot of it. My mother had rubella and was quarantined in the hospital in Washington in the 20s. She was very excited to tell her mother that the girls, my older sisters, had gotten the vaccine. Is this the nature of time, that we have forgotten the progress, and so we kind of succumb to the fears of what it could be, as opposed to remembering the history, learning from the history? Is that what this is?
It may be partly, but we've just gone through a pandemic. I think it's more than that. I think this is ideological. I think this is an approach, or an ideological approach to what public health is. I think it's much deeper, and I think it has very much to do with a concerted effort by specific groups, whether they were political groups, advocacy groups, even parent groups, to change the dialogue to what their beliefs are.
Yeah.
And when you put science in the realm of beliefs, you can't move forward. You can't move forward as a society, because yes, science can be wrong, but when we understand how science is wrong, we understand how science is wrong and how we can move forward. Beliefs are just, faith, and that's not a way to run a public health system.
Barb, I couldn't agree more. And we talk about the larger diseases, and we talk about the pandemic, but you don't even have to really look to those huge events to see the impact of disease. I mean, think about the flu season that we have just come out of. And, I've shared with all of you, I put off having my children vaccinated for the flu for various reasons. And part of it is just life getting in the way. And my 4-year-old had a very bad case of the flu. It wasn't to the extent that she was in the hospital or anything, but just seeing her so miserable for 8 days and seeing her probably sicker than I've ever seen her in her short life. And you're like, this can be prevented, and when you think about the science behind it, when you think about being in a classroom, and we haven't really even talked about whether or not certain vaccines should be required to attend school. You think about how easy it is for these things to spread, and how children can become very sick, and just, on a very basic parental level, seeing the heartbreak of a child suffer, and it can be prevented.
Yeah, I was going to jump in. I like to always quote Neil deGrasse Tyson on matters of science. And, he basically says without science, you got nothing. And he accepts the fact that science is messy. Well, are we going to accept the fact that there are gray areas and scientific understanding has to improve incrementally? But do you throw the baby out with the wash? And I think there's a couple myths that go around this. And I think that the trap is that the sciences can be messy, so maybe it's contradictory sometimes. Also, you hear of a case of someone, who took the vaccine but got the problem anyway, whatever the vaccine is. So some people rely on anecdotal evidence, and therefore the vaccine doesn't work because someone got it. Well, you can still get the flu if you have a vaccine against the flu. It's not a cure-all or a total safety net, but you might not get as sick, or you might be preventing it altogether. So I think there's a lot of misunderstanding, and as we've all been talking, that seems to put science on the back seat of a rumor mill of faith, of anecdotal information, whatever you want to call it. And I remember, Jay, you were talking back earlier also. I remember when the polio vaccine came into existence, and they went from a dead virus to a live virus. I remember my parents wondering whether that seemed kind of weird, putting a live virus into people. Let's give you a shot of polio to stop you from getting polio. And I remember they discussed it and kind of felt that the weight of evidence seemed to matter, fall down the side of doing that. But the caution is valuable in this. There's nothing wrong with having caution when you're dealing with matters of, as I say, of life and death and with your children. However, misinformation can be also very deadly in all this.
So we go into a 3-day weekend here in January. Martin Luther King Day is on Monday. And for the folks who are our age, I hate to always be on the age thing, but we remember when it wasn't a holiday and the battle to make it a holiday. But we thought it was interesting to visit. We are coming up next year on an anniversary of MLK. It was the first time it was celebrated as a federal holiday proposed by Ronald Reagan, passed by the House and Senate at that time. It's 1986. So in 2026, which is this year, we're coming up on holiday. It has been 40 years since MLK has been a federal holiday in the United States. There was controversy around that at the time. I want to read a couple numbers and then kind of discuss where we are now, because I think there's a perception that we had the first Black president, Barack Obama, and then we've had maybe some backsliding on some progress in civil rights in the last couple of years or last couple of terms of presidents. Let me read a couple of pieces of data, and then we can talk about that. Who in America has a positive view of Martin Luther King? Well, a YouGov poll in 2021, 89% of Americans have a positive view of MLK, including 67%, 2/3 of a very positive view. In America, that's a big number. I mean, I'm not sure you're going to get too many more people that have a higher number than that. Maybe Taylor Swift, I don't know. 81% of adults say Dr. King has had a positive impact on the country. That's from Pew in 2023. And in a national survey, More in Common, done with YouGov, More in Common, a civic organization, in 2023, they asked, is it important to observe the holiday? And at that time, 92% of Democrats, 82% of independents, and 73% of Republicans said it is important to observe the MLK holiday. One other quick thing, we looked at how people observe the holiday, and very few people do very much. I think this may be true around President's Day and Labor Day and Memorial Day too, so I'm not sure this is an outlier, but only 4% of Americans in that YouGov poll in 2021 said they plan to volunteer on MLK weekend. 56% say they're going to relax, 27% say they're going to have some family time, 21% said they're going to exercise, and 18% said they're going to work. So let's go back in the history. This did not happen at the flick of a switch. You're like, sure, let's do this. In the mid-'80s, this was still a very questionable, not questionable, this was still a very divisive thing to be making this a holiday. We've clearly made a lot of progress with these percentages, but I'm curious, Lee, you were obviously around at the time. You were a political science professor at the time. What's your thinking about how this has happened and where we've come?
Yeah, let me wind it back even a little bit further.
Yeah.
I know some just famously said, I don't want to always be the historian.
Well, you were there. It's okay. Fine. You were there. So yeah. Please.
So when Martin Luther King was assassinated in April of 1968, this was a person who was mostly vilified during his lifetime. This was not the Martin Luther King that occurred in public perceptions growing, after his death and then becoming part of a growing movement to make it a national holiday with, some detractors obviously to that in some states, holding out before that occurred within their state. But I think it's important, this isn't the Martin Luther King of today for both Black and white community is not the Martin Luther King of the 1960s. And now, whatever was the process by which it became a national holiday, now there's obviously some chipping away at that. And, the president in his New York Times interview this week said characteristically, I think, but he did say that during the civil rights movement, whites were victims and had lost some of the rights that they otherwise would have. I'm paraphrasing, but that gives a sense of, we go from vilified to a growing acceptance and a teaching tool and a way to reflect on that period of the civil rights movement to the White House now saying, yeah, there were two sides to that coin and that the white community suffered as a result of the perception that the Blacks were moving ahead. So I think that's a quick summary of 3 decades or 5 decades.
Barbara, I think it's really interesting that it was Reagan who actually proposed this and moved it forward because famously he started his campaign in a way, he launched his campaign for president in a way and in a place in Philadelphia, Mississippi that many people took as a sign of support for racism. And yet he's the one who pushed for an MLK holiday. We were there at the time. We're all adults at the time. What's your take on where we've come, at least since then, in the 40 years since it actually has become a holiday?
Well, I think there are actually numbers to support where we have come, since really the assassination of Martin Luther King to today. And there have been very, significant changes. And for instance, Black high school graduation rose from 25.7% in 1964 to over 90% in 2021. We look at Black voter turnout, which has also increased by a significant proportion from 1964 to 2020. And certainly the number of Black or African American college students has risen from, several 100,000 in 1964 to 2.72 million in 2021. So there have been enormous strides, which I believe helps the nation and the community, overall. It lifts all boats, I think contrary to some of the sentiment that we have been seeing and hearing in recent times. What I think, though, is most significant about these civic holidays, and I find important about them, regardless of some of the controversy that does surround them. For instance, Columbus Day or Indigenous Peoples Day in October, or President's Day and how we're remembering those presidents, or, MLK Day, is that we do at least get to talk about and reflect upon the history and the time that these people lived, and also the reasons behind why these civic holidays became holidays of note and a time of reflection. So even though most of us do take this as a long weekend and see this, as kind of a break from the work week, we still are reflecting upon the fact of who he was. I mean, I think his message of nonviolence really resonates. If you think of the early, bus boycotts, it's a very different approach, and something that actually may be kind of difficult to understand in our current political climate that is so, intense, and the language is so incredibly intense, and the actions are incredibly intense. I think to reflect back to that time, to see the gains that have been made, but to also reflect upon the message that he had at that time, of nonviolence and the fact that that can also bring change.
Yeah, and the problem I think is, if you go from a time of the notion that, as you cite in the numbers, that things have moved forward, there's been progress. On the other hand, for those who support the continuation of Martin Luther King Day or are happy that we do reflect, for those folks, it's still a very unfinished agenda, and we haven't exactly gotten to the perfect union at this point.
And I think Barb's point is well taken. On Monday, you will see in the news and you'll see in your social media feeds celebrations of Martin Luther King's life. You'll see politicians and regular people talking about that. And Barb, I think you're right. At the end of the day, whether any single person does anything other than relax or do whatever they're going to do, it is an opportunity to talk about him and what he stood for. And there's great value in that.
Okay, the fun fact, not necessarily a rah-rah, ha-ha fun fact, but it does relate to the discussion we're having. And I thought it was kind of an interesting fun fact. So let me get right to it. This was from 2016, a 60 Minutes Vanity Fair poll supplied to us from our friends at the Roper Center. And the question was asked of a national audience: which would have surprised our founding fathers more, the election of Barack Obama in 2008 or the election of Donald Trump in 2016? So I thought that was kind of a really, polar opposite kind of question. It really reflects on where people think things were. And Barack Obama, as a surprise factor, in 2008, his election scored 45%. Donald Trump in 2016 gets a very close 42% of the national audience thinking that would have been a shocker. I think there's one thing to throw into this when you literally talk about the founding fathers. That was a time of slavery in America. And you can't overlook the fact that from slavery to Barack Obama is probably a little bit bigger jump than most people would have made at that point, saying there was nothing in it. It's as if we had a woman president. Do we have one? No, we haven't. So anyway, it would have done a similar impact. So what do you guys make of all this?
Well, Lee, you raised a good point. I mean, I agree with you. The first thing that came to my mind was slavery, and that who most closely resembles the founding fathers, Donald Trump. But when you bring up a woman president, who was Donald Trump running against in 2016? He was running against Hillary Clinton. So, which is harder to believe, a woman president becoming a woman becoming president or an African-American becoming.
And with Kamala Harris in 2024. So
yes,
it's a double. Yeah.
But I mean, my mind immediately went, I was surprised by the numbers because I thought there'd be a much greater proportion of those who thought it was surprising that Barack Obama would be president. I think, Barb, you're shaking your head. I think you agree with me.
Yeah, I'm nodding, Mary. Yes, I completely agree. I was actually very surprised by these numbers because at the time of the founding fathers, Black Americans were not considered. I mean, they were considered property. So this was not just would not just be a surprise, but really a generational change, many generation changes. And I do kind of like your characterization, Mary, of the fact that, Donald Trump kind of looks like the guys at the time, somebody with wealth and position and, popularity from the media of the times. Yeah, I think he's
a white male.
Well, obviously that part too, but I'm just saying, that he's very much in the tradition of the demographics and the position in society of many of the founding fathers.
Yeah, I think it may be even more than that. I don't think any founding father would have not been really surprised by a Black person or a woman being president. I don't think, not only would they not be surprised by Trump, that is what they feared. They feared the unitary executive. They feared the president trying to become a king. That's what is so much of what the founding fathers wrote about and argued about, not only during the Articles of Confederation, but during the time of putting the Constitution together after the failure of the first organization in the United States, is all about that. How do you build a country where you don't have a leader that becomes the king? So not only I just find this poll to be kind of ahistoric. I don't think people really know their history very well because there's no way in the world they would have imagined a Black guy being president. And there's no way in the world that they couldn't have imagined Donald Trump becoming president because it's one of the things they feared most.
Yeah, and I'm not totally convinced everybody thought back to the founding fathers and what was going on at that period, and maybe answering just how surprised they are or they were that these two events actually happened.
Yeah.
It may be, not everybody necessarily thought of the founding fathers and the slavery and the gender and all those things.
Well, also, just to bring this full circle, I would love to see the partisan breakdown on this because it's pretty evenly divided, and maybe we are just harkening back to the idea of a divided America.
Yeah, and that maybe half the country was happy with Obama winning, and half the country was happy with Donald Trump winning, and pretty much the split was there and not necessarily resolved, as were issues of the founding fathers, not necessarily resolved at the time. That was a little bit of a leap.
So Tommy and AJ, what do you guys, I mean, this is obviously, you guys are much younger than we are, right? What was your reaction to seeing this?
Yeah, when Cassie showed me this, I was just super surprised by the numbers because I don't know, it just doesn't make sense to me. Like, I thought it would just be all Barack Obama just because of the era, like what you guys have been saying before. Yeah, it's just, I don't know, it's just really surprising. AJ, what do you think?
I agree. I'm taking it back a little bit. I think that the answer is kind of obvious, unfortunately.
And that's why we measure public opinion.
Yeah, it helps. It helps. Anyway, thank you all. And that wraps it for this week. And we'll catch up with you next week where I understand, Jay, we're having a special program. Is that correct?
We are, and you and I are not involved. It is a ladies only show, but not for the reasons you might suspect. It's great. This is a really great show coming up. So we will be listening, but we will not be directly involved. So stick around for that coming next week.
Have a great week.
That'll do it for Poll Hub this week.
Poll Hub is produced by the Marist Poll at Marist University in Poughkeepsie, New York.
Mary Griffith is our executive producer.
Casey Schaff is our production supervisor.
The Poll Hub team includes AJ Gambino, Tommy Rogers, Cassie Connors, Sylvia Weiser, and Molly Goodger.
If you enjoy Poll Hub, consider telling a friend about us.
If you'd like to learn more about polling and survey science, check out the Marist Poll Academy, our free online learning portal accessible from our website.
Remember, you can always tell your smart speaker to play Poll Hub, and with any luck, it'll cooperate.
Finally, wherever you listen to Poll Hub, there is a subscribe button. Click it, and the latest episode will be ready for you in your podcasting app as soon as it's released.
We'll see you next time.